So my name is Javier Oesterheld, and I am the division chief here at Cancer and Blood Disorders program at Levine Children's Hospital. I've been here about 18 years. We are a program who does all cancer care. I'm also the Jeff Gordon Children's Foundation Endowed Chair for Cancer and Blood, and also the Vice Chair of Clinical for Levine Children's Hospital. My work in neuroblastoma started as a fellow, where I was in a basic science lab at Columbia Presbyterian, doing a little bit of work on tumor endothelial cells in that space. And then really, once I started my career here at Levine Children's, became the so-called expert locally on neuroblastoma. I've been following that disease ever since, and I am the person who sees all the neuroblastoma patients at my institution. The ARISE Cancer Consortium is brand new. We here at Levine Children's really believed that the Carolinas is a special place. And so we wanted to try and get all of the centers that are around us. And so in the Carolinas, North and South Carolina, there are 10 institutions which take care of pediatric patients with cancer. And so one of the really pushing kind of drivers for ARISE was, how do we get our young investigators really engaged in trying to write clinical trials, do biologic work, do survivorship work, and do some of the stuff that some of the bigger consortiums really can't tackle. And so more of, how do we take care of our patients today? One of the things that I thought was really incredible was we had our first meeting, which was just a collection of different physicians from each group in the Carolinas meet in 2022. And it was really great. We just got around a table and everyone said, okay, there's this need to do solid tumor research, brain and extracranial, as well as survivorship research, and really looking at our demographic, the rural population that exists in the Carolinas, and how do we get them to centers to do any sort of research, be it biologic research, be it clinical trials, be it this. And so what I really like about ARISE is that it was a collaborative effort with all of those investigators in a room. That is actually how we named ARISE. All of that was pretty incredible. And so one of the things that I'm the most proud of is in 2025, we had our first true annual meeting where we presented some of the science at places like Duke, MUSC, UNC Chapel Hill, at Levine Children's, and really what our lab's doing, what kind of research do we want to attack. And it was very clear that a lot of it had to do with sarcoma research, trying to figure out, how do we predict metastases, how do we pay attention to that. And then the second part of it that was really incredible is a lot of our patients will survive in a lot of different diagnoses, and how do we make survivorship better for them? And how do we, as a larger organization with ARISE, really look at that? Currently, we have 9 of the 10 institutions in the Carolinas engaged. So there is a principal investigator at each institution. So that's at least 9 physicians. And at the annual meeting, we had probably about 50 physicians and physician scientists across the table with some of our research folks. So the ARISE Cancer Consortium, which is the Alliance for Research and Innovations in Pediatric Oncology, it has a lot of goals. We're really expansive. We really want it to be a collaborative initiative aimed at advancing research, supportive care, and treatment for children, adolescents, and young adults that are undergoing the cancer journey. And for us, the consortium's goals really focuses on improving patient care, as I mentioned, access to new therapies and clinical trials. And really, we want to take care of the patient where they're at. The goal is for you at your local institution to have options and to have availability of these clinical trials, and making sure that you can stay with your support system locally. That's really important. A lot of what we built at Levine Children's had to do with how we care for our patients today. And I really believe in that. And I think as the investigators sat around the table in our first few years of creating this consortium, the belief was, how can we take care of our children in North and South Carolina in their home and in their town, and offer them novel and cool things? And that's really the goal. Right now at the ARISE Cancer Consortium, we are starting with 2 clinical trials, and we're excited about them. The first one is actually a fairly basic trial, but it's something that we've really not looked at in this country in a systematic way. And so if you're diagnosed with osteosarcoma, which is a sarcoma of the bone, we use a medicine called methotrexate. So you come into the hospital, you receive a very large dose of methotrexate, and we wait for that dose to clear, and we check, as you would expect, methotrexate levels. Those methotrexate levels, historically, by most of our clinical trials, have used a very specific number of 0.1 to be able to send your child home. We are looking at increasing that number to 0.2. And what that means is that my hope and our hope as the consortium is that you will be able to go home 24 to 36 hours before you actually do today in our country. And so that seems pretty simple, but to do that across 9 sites to make sure that all of that is validated and make sure we're doing it well, we're excited about that because I think that'll give a lot of support to these families who don't want to be in the hospital. Most of these patients are young adults, teenagers, and as you well know, teenagers definitely don't want to be in the hospital. So we're excited about that. At the same time, one of the things that was a overarching mission for ARISE was to include biologic corollaries. And so from our osteosarcoma patients that are enrolled on this study, in collaboration with a researcher at Duke, we are looking at osteosarcoma organoids, which is really exciting because that is looking at how do we deliver drugs to that specific tumor. The second protocol that we are looking at is in our survivorship space. And so we know very well that there is a concept of early aging in our childhood cancer survivors. And so we're looking specifically at a marker in the blood to see if we can figure out, okay, are you early aging by this very well-known level? And can we change that by including exercise in your therapy? And so it's quite simple. You take the test, you see if you are up or down on that and see if you have signs of early aging. And then we have a prescribed exercise curriculum for about 12 weeks. And then we take the test over again. Some preliminary data from the researchers at UNC and Novant Presbyterian here in Charlotte show that we should see some changes. And so that second study will open in second quarter of 2026. And we expect our methotrexate study to open in the next month in September of 2025. One of our initial goals at the ARISE Cancer Consortium was to keep it local in the Carolinas. We really wanted the first 3 to 5 years to really make sure that we're impacting our population here. But obviously, our goal would be to expand that if possible. If we can get some traction, if we can build these clinical trials in a really smart, intelligent way. My hope is that we'll get lots of publications out of these trials, lots of engagement from our junior faculty and our senior faculty at these institutions, and then really kind of show that we can do this locally before moving to a regional and national level. But that would be the goal. Right now, we're just trying to walk before we run, but we're excited about it.